this instruction, and then you have to tell me patient skin exposed. L5 is below the knee along the stomach channel. So you draw along this area, right? So is this still same as this? Okay? Sure. That's L5. S1 is a muscle test is a peroneus longus and brevis. This is a little bit awkward. So peroneus is in the muscle is on the gallbladder channel. Okay, so imagine that. So muscle is in here. Peroneus longus and brevis is here. Okay, you imagine if this muscle only pulled, right? If this thing is pulled, then what happened to the ankle? It's the foot. Foot will go up 45 degrees up that way. So basically, ankle will go up like this. Yeah, eversion. Okay, so hold it like this. Okay. For this also, you have to grab patient's ankle to give them a support. Okay, one second. Hold this position. I'm gonna push this down toward this floor. You resist it. Ready? Hold. Hold. Okay. Deep channel reflex for S1 is Achilles. Achilles, you put your one hand on UB60, the other hand on kidney 3. Then you're gonna grab one tendon behind the ankle. Right here. Right? Feel the tendon here, right? Okay? So you're gonna hit that tendon. Okay? To enhance that, actually this kind of shoes is very difficult to get because of the support. So usually for this kind of shoe, you have to ask the patient to take it off. For demonstrate purpose one, I'm just gonna do it. So to make your life a little bit simpler, you gently make sure ask the patient to not help you. Just lift the patient. Can you relax? Relax your foot. Okay. I'm gonna lift this up a little bit. You don't need help. Okay. So you gently lift this up. When you lift this up, then it's gonna give more tension goes into the Achilles tendon. Right? And then you're gonna using back of this. You're gonna hit patient's ankle. You see it? Yeah. Relax, relax. Relax, you don't need to help. See it? The foot drops, right?
Which part of the Achilles are you hitting with?
It
Right in the middle?
doesn't really matter, but just hit ankle. You can hit anywhere here.
Okay.
But to make it explanation easier, so that's why using the UV60 hitting 3. But actually, you don't need to be that specific.
When you ask the patient to pick up the socks.
No, you don't need to take off the socks for
Just the shoes.
tendon. Oh, if this kind of shoes, it's okay.
Oh.
But this one has the ankle support. So, no. Okay, and make sure you do it bilaterally. No, relax. Okay. Foot drop, right? When patient is not relaxed, then you're not gonna get the reflex. So ask the patient to lift it to relax. How you tell the patient is relaxed or not? When you do that, and when you let it go, suppose you drop like this, right? But when you remove your hand, if foot is still up, then patient is not relaxing. I know living in New York, it's not that easy to relax though. Because people cannot trust anybody, so. Okay, for S1.
That's good reason.
Even though when you hold your patient's arm, ask the patient to relax, and after you remove your hand, patient hand will still goes up like this. Then how they relax? But that's how we go through that. For S1 is lower the you have to use the sensory area for S1 is the back of the leg, behind the below the knee, along the UV channel. UV channel goes to the pinky toe. Okay, so using the pinwheel, you follow you draw the line along that UV channel. Okay, so is this below? Same as this.
Yes.
Okay, of course you have to give the instruction and expose the skin. Okay. Any question for number 1 through number 5? I think this is the longest way, longest one to explain. Okay. So next one, number 6. Can you lay on your back, please? Okay, number 6 and number 7 is the same. Okay, can you slide up?
You want the sheet, please?
Yeah, lumbar. Change sciatic to lumbar. Sorry about that. Number 6 and 7. 6 and 7,
Really?
change the sciatic to lumbar.
Yeah.
Okay.
Can't
Number
see
6 and 7 is the same test, but it's the difference is number 6 is positive straight leg raise test, positive progress, and positive well straight leg raise test. But the 7 is a negative. That's so. But basically number 6 and number 7, the same test that you have to perform during practical exam. Okay. So for number 6 and 7, I'm going to demonstrate same time. So for the number 6 and number 7 question, pretend patient came into your clinic. Patient complains low back pain, radiating pain goes down to the right side of the leg. Okay? So whatever that is, the patient will have a problem on the right side. Okay? So number 6 and 7, this is a passive movement. Okay? So this is how you're going to do.
Yeah, I can see.
So this is a passive movement. Patient is supposed to be relaxed. You're going to lift the patient's leg up. Okay? So I'm going to lift your leg up. When you have a pain, let me know. Okay? You don't need to help me anything. So make sure patient's leg is straight. Okay? So I usually grab patient's ankle and grab patient's knee too, to make sure the knee is straight. Okay? Ready? Let me know when you start to feel pain anywhere in the body. Okay? And then gently you lift it up. And do you have any pain? Any pain? Any pain? Any pain?
Yes.
Right here. Okay? So this is straight leg raise test. Okay?
Do you keep the leg always straight? Or you
Yeah,
bend
oh,
okay?
no,
Oh,
straight.
straight, okay.
It is straight. Okay? Then for breakers, you have to lower the patient's leg until patient's pain eases up. Okay? So I'm going to bring this down. Let me know when your pain eases up. Okay? And gently you right here. Okay? And then when you reach that level, then you suddenly dorsiflex patient's ankle. Any pain? Yes.
That's possible.
That's positive, right? But during the test, practical exam, you don't need to tell me which test or name. You don't need to tell me the name of the test.
We need to tell you the degree.
No, you
But-
don't need to. You don't need to tell me anything. You just need to instruct the patient. Show me how you perform. You don't need to tell me name of the test. If you wanna say it, you better be right. If you're wrong, I will cut out the point. But if you are right, it's fine.
But we don't need to tell you if it's a positive or negative finding.
No, you don't need to tell me. You just need to perform the test and instruct. You have to show me how you're gonna instruct the patient. That's all. Okay? So you did the SLR with the braggers. So you're gonna perform well straight regular test. So you're gonna, for body mechanism wise, you better stand on upper side. Same thing. I'm gonna lift your leg up. Let me know when you start to feel pain. And lift it up. Any pain? Any pain? Any pain? Any pain? Right. Okay? So look at this. If you do this, then I will cut the point. Let me know when you start to feel pain. The patient cannot evaluate, right? You have to do it gently, slowly, lift the patient's leg up. Oh, I forgot something that, I used to be a medical examiner for the insurance. So I went to the clinic to evaluate the patient, but there was orthopedist was there too. So he was asking me whether I want to evaluate the patient with him. So I said, okay, why not? And I was so amazed how he performed. I will show you how he performed. Have a seat. He was doing a reflex test. He was doing this. Can you slide over? Okay. He was literally doing this. Ready? Ow! He was doing this.